Yeah, just a quick review of the book, Sports Injuries Guidebook, the best resource for identification, treatment, recovery, and return to play. Basically, the book's divided up into 17 chapters. I'll name each one briefly just to give you an idea what's in the book. First one is biomechanics of function and injury. Two is body maintenance, conditioning, strength, injury prevention. Third chapter is injury types. It goes into assessment and management. Four is concussions and injuries. And then from here on down, it's kind of like the chapters. It's like you start at the top of your body and work your way down to different areas. So it has like chapter 5 is the neck and cervical spine. 6 is shoulder injuries. 7 is arm and elbow. It goes into wrist and hands. Chest and abdomen. Keeps going down. Back injuries is 10. Hip injuries, chapter 11. 12 are the thighs and hamstrings. The knees 13, 14 is the lower leg and ankle, and the foot and toe for 15. And then 16 is like complementary and integrative health and sports injuries. And then 17 has injection therapy and biologics. It's kind of interesting. So yeah, as you can see, if you're looking for a resource for some common sports injuries, I think this is a great book. I think it's mainly for people like athletic trainers, people who deal with a lot of sports injuries. If, on the other hand, you're like a lay person and you just want to know, like, hey, I have plantar fasciitis. What do I do about it? This may or may not be your best book. You might want to look for a specific book. For instance, like say you tore your rotator cuff. This is a good example here, the 6-minute torn rotator cuff solution. That's more for the layman. I'll show you briefly why. Basically, written in easy to understand language. That goes like what exactly is the rotator cuff. Has a lot of pictures and stuff. If you're a visual learner, real easy to get to figure that out. Answers you need to know. What are the symptoms of a rotator cuff tear? Are there arm maneuvers that might indicate I have a tear? Where does it tear at? Are there different kinds of rotator cuff tears? I have rotator cuff tear and I'm in a lot of pain. I need surgery, right? Well, not necessarily. This is a very evidence-based book, but is in layman's terms. So you could hand this to anybody, like a patient or something, or if you just, anybody on the street tore their rotator cuff, what do I do? Each one of these is a study. So basically, if the studies here to answer this question, book's gone all through the published research, and they looked at the studies where you take a bunch of people that have like a torn rotator cuff, and then the researchers look at the tear size and how much pain they're in, and they find a lot of times there isn't a lot of correlation between tear size and pain, because there's people with big tears that have no pain, so there's a lot of asymptomatic tears. On the other hand, there are a lot of people that have small tears and a lot of pain, so pain isn't necessarily the biggest indicator of surgery. What will happen if I just leave my rotator cuff tear alone? Here again, evidence-based medicine, you have to look at the studies where you take a group of untreated rotator cuff tears and you follow them for like 5 or 10 years to see what happens. This book has done that for you. Here again, like I say, more for the layman's, very easy to understand studies. How does exercise compare to surgery when it comes to treating a rotator cuff tear? Here again, evidence-based, you have to look at the randomized controlled trials. What are the consistent findings? This is their studies where basically, you might take 100 people and 50 you're randomized to surgery, the other 50 you're randomized to exercise, and then you follow them for a while and see what happens. Who does better? Long story short, and a quite consistent finding in the research, according to this book, which has actually compiled all of the randomized controlled trials, whether you have surgery or exercise, you can end up at the same place. To that end, the book ends with an exercise program. It has a beginning, intermediate, advanced program. So yeah, it really does take you 6 minutes. I've looked at it. So basically, difference, compare and contrast. This is a book for the layman on a specific injury. However, if you're looking for just a resource, general resource on a bunch of different sports injuries, this is a good book. So yeah, check it out.